cognizant of how close a tie there is between the mouth and the body, and how many things the mouth can influence within the body. And particularly, we were talking about gum disease, which can represent an infection at least the size of your palm. Nobody sees it, maybe you can smell it, but most of the time people aren't aware they've got it. And many physicians don't even look in the mouth, don't even think about the mouth. They look past the mouth and look at the tonsils. I'm trying to change that. And I'm one of the founders of the American Academy for Oral Systemic Health. We're very interested in making sure we're all on the same page, recognizing how much the mouth can influence the health of the rest of the body, and vice versa. And in particular, here we're talking about the uses of ozone to help prevent some of these problems. Ozone is a very powerful antibacterial. So in the mouth, we can kill all of the germs that can then get into the body. We can get rid of the inflammation and infection in the mouth. And everybody is very worried about bacteria, but a lot of gum disease is from fungi, from molds. So we can get rid of molds, we can get rid of viruses, which also play a part. Fungi, lots of very bad things can start in the mouth when you have an infection as big as your hand. Now, most people, if they had an infection as big as their hand, let's say it was on the surface of their face, they'd be worried. And yet, when it's inside your mouth, you don't even know it's there. It very rarely hurts until the very end stages, and then finally the teeth will start to get loose. You can see the gums going down, but that's very late in the game. And we now have techniques where we can find out that this disease is in progress, like testing for germ DNA. If you do that early, you can stop this process from getting that bad, from the infection being this large, and then getting into the rest of the body. So I want to make sure all of the physicians here are very much aware of that. Ozone is the best thing that we've got. Ozone comes in lots of different forms, though. In the office, we will use gas, ozone gas, down inside the little crevices next to the teeth. Kill off the germs very powerfully there. We'll use ozonated water, and we'll actually give the patients ozonated oils to take home. And you can take a very tiny little bit of that and put it in between the teeth, and it works for hours, killing the germs and getting rid of the toxic waste products that the germs leave behind, because it's not just the germs that are problems. It's the things that they leave behind that are essentially dead materials that then get into the gums, into the bone, and then go right through the circulation to your heart, your lung, your kidneys, your liver, and can have profound effects on the rest of the body. So it's really important to understand the importance, A, of the attachment of the mouth to the body, and B, how we can really deal with some of these problems, particularly using ozone. And I'm very hopeful that the medical school here is going to start to work with us and really get that program going for everybody here in Aruba.